So here we go. Here's our review. This is some review on pharmacology. Mostly we're going to talk about antibiotics. And I know you guys are thinking, oh god, there's so many. But you know what? That's going to be okay. Because we're going to go through it slowly. Alright? Now calm down. Alright. First of all, let's get covered on the two categories of antimicrobial drugs. First of all, we got bactericidal, and it's like, I'm gonna kill you, rah! But then the bacteria is all like, oh no, because it gets killed. So yeah, that's what cidal means that it's killer. Yeah. Then we got bacteriostatic over here, and it's the cock block of the antimicrobial world, because it inhibits growth, and most of the time it interacts with the protein synthesis, which makes stuff not have babies, so they can't procreate. So of course, her dreams of kids and marriage are gone. Alright, so as we continue, first, our first group of antimicrobials is the beta-lactam family, and in this category, there are two of them. There's the penicillins and the cephalosporins. So as we go through these, look, I made like little symbols and stuff. So it can be given parenterally or orally. So the parental means that it can be given either IV, IM, or what's the other one? Sub-Q. And then it's also, what do you call that? Metabolized. There you go. It's metabolized by the liver and then also excreted through the kidneys. Then we've got some exploding action going on because it interacts with the cell wall and it lets a lot of stuff into the cell, and then the bacteria just kind of gives up and it explodes. And then takes care of gram-positive bacteria. And those are some examples. Lovely examples. Alright, then we move on to cephalosporins. And then those are also given by injectable as well. And they're metabolized by the kidney. No, wait, no. I meant liver. Just testing you guys. So then they're metabolized by the liver, excreted through the kidneys. Let's see. Oh, so the tricky thing about this is that they're ninjas. They sneak through the cell wall, unlike that one where they just bind on the cell wall and then they just make it explode like that. They actually sneak in. They're kind of like little ninjas. And then they make the cell explode. Yeah, it's kind of awesome that way. So, and after that, let's see, Yep, and then it's effective against gram-positive and some gram-negative bacteria. And those are some examples. Yeah. Alright. Now we move on to the tetracyclines. It's kind of exciting. And then, let's see. So some of the things that you can do with tetracyclines, you can give it by injection. You can also give it orally. Then it's metabolized by the liver, then excreted through the kidneys. Woo! And it's bacteriostatic, which means it stops the baby making process. So it's effective against gram-positive and gram-negative bacteria. And also it's distributed quickly through the tissue and sometimes penetrates into the central nervous system. Wish I drew a picture of a brain now. But yeah. And then one thing that you have to, well, there are a couple of things that you have to worry about. But like one of the things that you have to worry about with that is that it's renal toxic in high doses. And it can cause fever in cats. And please never give to horses, otherwise there will be bad things happening. And then it also affects bone and teeth in young animals. There's some examples right there. Don't really feel like pronouncing them. Alright. So next we move on to aminoglycosides. Okay, so it can be given, let's see, parenterally and topically. That's what the little thing is. It's actually like a little topical medication thing. But most of the time, it's actually absorbed into the bloodstream, so no liver involved here. So after it's absorbed into the bloodstream, then it goes to the tissues that need it most. And then after they do that, then it gets transported from the bloodstream to the extracellular fluid. And then it goes to this, the CSF, the respiratory secretions, either that or like eye solutions and whatnot. And then it gets excreted through the kidneys. Ha! Alright. And then it makes the cells explode. It's kind of awesome. Yep. Let's see. Then it's effective against gram-positive and gram-negative bacteria. The thing is that you have to have strong kidneys in order to do this, so any patient with kidney failure, bad idea. No, bad idea. And then it also causes ototoxicity, because sometimes they like to gather That's like the little things over. Oh, there we go. That's like the little things over here. Little aminoglycoside bacteria. Yeah, they're killing the bacteria, but they like to gather in the ear, so sometimes that could cause deafness. And those are some examples. Whee! All right, and then the next one is the fluoroquinolones. Okay, say that say that 5 times fast. Fluoroquinolones. All right, I think I got it. All right, so it can be given parenterally or orally. Yay! And then it's absorbed by the tissue, which that's like absorbing action right there. Then it's metabolized by the liver and excreted through the kidneys. Woo! It's bactericidal. Ooh, let me zoom out. Bactericidal. Oh, it's gonna kill stuff. So it means that it's effective against gram-positive and gram-negative. Woo! Try not to use it in young animals. Don't use in dogs with seizures. Those are some examples of it. Let's see if I forgot anything. Looks like it's used for bacterial skin and soft tissue infections, respiratory infections, cystitis, and in cattle, it's used for feedlot heifers, respiratory disease, and it's banned for use in poultry. Good to know. All right, so it looks like we're time to move on to chloramphenicol. So, yeah, there we go. We got all of it. So, chloramphenicol is usually only given orally. When we say topically, it's usually for the eye. And apparently this drug is kind of a bad drug, so it's rarely used, but sometimes it can only take care of like some aspects of different things, of bacteria, because they're not really immune to it yet. So yeah, little tidbit there. And then metabolized by the liver, excreted through the kidney. And it's also bacteriostatic. Ooh, it stops the baby makers. So, it's effective against, let's see, gram-positive and gram-negative. Oh yeah, that was like a little thing that I put in there. And then some bad stuff about it is that it causes bone marrow suppression and or anemia, and optic and peripheral nerve inflammation. Yeah, that kind of sucks. But one of the things is aplastic anemia is nasty. No one wants to get aplastic anemia. So there are no solutions, because most of the time this is a generic thing. And yeah. About it for that one. It's basically used for bacterial respiratory infections, UTI, enteritis, conjunctivitis, and meningitis, and ristixial disease? Yeah, say that 5 times fast. Alright, now we move on to the next one. Zoom out. There we go, chloramphenicol. Yeah, there's not really that much there. But basically, there's only one type, just because, what do you call it? I guess it's a new drug or something like that, so there's only the new 4 injection. And it goes to all surrounding tissues, including the CNS and the cerebrospinal fluid. And it also is metabolized by the liver and excreted through the kidneys, and it's only available in injectable. It's bacteriostatic, so stops baby makers. Then, let's see, I think that's about it. It uses respiratory disease associated with Pasteurella, and it's mainly used in feedlot cattle, apparently. Alright, now on to the macrolides and lincomycin. It's a handful. So look, I'm not even going to try and pronounce all of these, so yeah, just go ahead and read all that. Yep, lincomycin. I don't really know how to pronounce those either. So yeah, it's available for injection. I scrolled too far, hold on. Yep, it's given orally and some parenteral, because you don't want to give it IV. Never give it IV. So IM and sub-Q are fine. So, let's see. It's bacteriostatic. Stops baby makers. And it's effective against gram-positive and gram-negative bacteria. Yeah, how do you like that? Yeah. Then the last one that we're going to talk about today is sulfonamides. And I drew like little hoof prints and stuff. Yeah, see those hoof prints? Yeah, I drew those. So it's only used in large animal. So a couple of things about it. That's why I drew a horse instead of a dog this time. So yeah, it's used, it can be given orally and some parenteral, because it can actually only be given, what do you call it, IV. So yeah, because it's actually very irritating to tissue, so never give it IM or or sub-Q, because then the horse will probably kick you and stuff. So that's never good. Then it's also metabolized by the liver, excreted through the kidneys, and it's effective against gram-positive and gram-negative drugs. I meant to write bacteria. Ha! Oops, I'm tired. It's hard to erase and look at the same time. Alright, there we go. So, let's see. Immunity to this drug is starting to take place, so we don't want to use it all the time. But those are the different types of drugs that are out there. And it's actually used for, let's see, UTIs, no cardiosis in combination with, oh wow, toxoplasmosis? Let's see. And a lot of stuff that I can't really pronounce, so we're not going to worry about that right now, okay? Alright, kids. That's it. Those are the major groups of the antibiotics. Woo! This was all chapter 12 last year. So that concludes this chapter 7.